Imagine waking up one morning, checking your blood pressure, and seeing a number you haven't seen in years. Not because of pills, not because of exhausting workouts, but because of a few simple foods you started eating every day? Sounds unrealistic? What if it's not? For over 20 years, I've worked with men over 50, watching the same pattern repeat again and again. Patients walk into their cardiologist's office, expecting another prescription. But instead, something unexpected happens. Their numbers improve, their blood pressure drops, and their doctor starts reducing their medication. Not because they asked for it, but because the data made it unavoidable. What changed wasn't luck. It wasn't extreme exercise. It was a small set of daily habits that work directly with the body, not against it. Before we go deeper, there's something you need to know. Right in the middle of this video, I'm going to reveal 3 common things that are probably in your home right now. And here's the problem. These 3 things can silently cancel out everything you're doing right. Every healthy meal, every good habit. If you skip that part, you might only get a fraction of the results. So stay with me, because that section may matter more than anything else today. Inside your body, your arteries produce something powerful, a gas called nitric oxide. It's your body's natural way to relax and widen blood vessels. When vessels relax, blood flows easier, pressure drops. But here's the problem. After the age of 50, your body produces less and less of it. And most medications don't fix this root cause. They manage the symptoms. The foods you're about to learn work differently. They support this exact pathway, helping your body restore what it's losing over time. Let's start with one of the most powerful options, beet juice. Beets are loaded with natural nitrates. When you drink it, those nitrates travel to your mouth, where bacteria begin converting them. Step by step, they turn into nitric oxide inside your body. And when that happens, your blood vessels relax almost on command. Studies have shown just one small glass a day can reduce blood pressure within hours. The key is consistency. Drink about 250 milliliters every morning. Room temperature works best. If the taste feels too strong, mix it with a little apple juice. Simple habit, powerful effect. Now here's something most people overlook, even though it's sitting right there in the grocery store. Arugula. This leafy green actually contains even more nitrates per gram than beets. But that's not the only advantage. Arugula is also rich in potassium, and potassium plays a critical role in balancing your blood pressure. It signals your kidneys to release excess sodium from your body. Less sodium means less water retention, less pressure inside your arteries. But there's one important rule. Do not cook it. Heat destroys the very compounds that make it effective. Eat it raw. A simple salad with olive oil and lemon is more than enough. Small change, real impact. If this is something you can start today, comment the number 1 below. Now let me ask you something. What if there was a tea that worked almost like a prescription drug? Not similar. Not close. The same biological mechanism, hibiscus tea. It contains powerful compounds that block an enzyme called ACE. This is the exact target of one of the most common blood pressure medications. When this enzyme is blocked, your blood vessels stay relaxed. Your pressure goes down naturally. Clinical studies have shown consistent reductions over time. The protocol is simple. Steep dried hibiscus flowers in hot water for about 10 minutes. Drink 1 to 2 cups daily. But if you're already on medication, talk to your doctor first, because this combination can be stronger than you expect. Garlic is something everyone knows, but almost everyone uses it wrong. Here's the detail that changes everything. When you crush garlic, a chemical reaction begins. It creates a compound called allicin. This compound is responsible for most of garlic's heart benefits, but it doesn't stop there. Inside your body, it turns into another powerful signal that helps your blood vessels relax. Here's the mistake. Most people cook garlic immediately. And heat destroys the enzyme that creates allicin. No enzyme, no benefit. The correct method is simple. Crush or chop the garlic. Wait 10 minutes, then eat it. That waiting time is where the real power happens. This next one has some of the strongest long-term data. Ground flaxseed. In clinical studies, people who added it daily saw significant drops in blood pressure over several months. We're not talking small changes. We're talking numbers, comparable to some medications. And it works through multiple pathways. It reduces inflammation, supports hormone balance, improves gut health. All of these directly affect your cardiovascular system. But there's one detail you cannot ignore. It must be ground. Whole flaxseed passes through your body without being fully absorbed. 2 tablespoons a day is all you need. Add it to yogurt, smoothies, or oatmeal. Simple habit. Long-term results. Now here's one that surprises most people. Dark chocolate, but not just any chocolate. Minimum 85% cacao. Inside cacao, there are powerful compounds called flavonoids. These compounds activate an enzyme that helps your body produce nitric oxide on its own. Not from food, but from inside your arteries. This means you're not just supplying materials. You're turning on the factory itself. Studies have shown regular intake can lower blood pressure in multiple populations. The key is moderation. About 20 to 30 grams per day. Just a few small squares. Simple, enjoyable, and effective. Now imagine this. You're doing everything right. Eating the right foods. Following every step. But something invisible is destroying your results. That's oxidative stress. It breaks down nitric oxide before it can even work. This is where pomegranate comes in. Pomegranate is loaded with antioxidants that protect nitric oxide from being destroyed. Think of it as a shield. It doesn't create nitric oxide. It protects what you already have. Studies show it can lower blood pressure while increasing nitric oxide levels. About 150 milliliters per day is enough to make a difference. Protect the system, and everything else works better. Now this part may be the most important of all, because for many people, everything we just covered will never reach its full potential. Not because it doesn't work, but because of 3 hidden habits that quietly destroy the process. Number 1, mouthwash. Antibacterial formulas don't just kill bad bacteria, they kill the good ones too. The same bacteria, your body needs to produce nitric oxide. Number 2, high-carb breakfasts. Sugar and refined carbs trigger insulin spikes, and insulin tells your body to hold on to sodium. More sodium means higher blood pressure. Number 3, common painkillers. Some medications can interfere with your body's ability to regulate blood pressure properly. So even if you're doing everything right, these 3 can undo it. If you understand this, comment the number 1 below, because awareness is where real change begins. There's one final piece that most people never hear about. It's called the morning surge. Between 6 and 10 a.m., your body naturally releases stress hormones, cortisol, adrenaline. These hormones cause your blood pressure to spike. In fact, this is the time of day when most heart attacks and strokes happen. Now here's the key idea. Your morning routine either makes this surge worse or helps control it. When you combine everything we discussed, beet juice in the morning, garlic prepared the right way, a low-carb breakfast, you're not just reacting, you're preparing your body before the danger window even begins. That's the difference between managing symptoms and taking control of the system. So here's the truth. This is not about one food or one quick fix. This is a system. 7 foods working together, supporting your body from multiple directions at once. While most approaches only focus on the symptoms, this approach targets the root. Now imagine this. 3 months from today, your numbers are lower. Your doctor is adjusting your medication, and you feel more in control than you have in years. That future doesn't happen by accident. It starts with what you do today. If you want more breakdowns like this, hit subscribe right now, because the next video might be exactly what your body needs.